Hello, Assalamualaikum. Okay, so let's begin our today's class. And I think you people are just interested in PDF. Walaikum Assalam. Yeah, how are you? मुझे लगता है सबको सिर्फ PDF चाहिए थे, है ना? So I think कि PDF एक्सेस खत्म की जाए और सिर्फ रिकॉर्डेड लेक्चर्स दिए जाए, ठीक है? मुझे लगता है कि कुछ थोड़ा चेंज करना पड़ेगा, सही है? बिकॉज ये लेक्चर्स दिस डिस्कशन इज जस्ट मेंट फॉर यू. डिस्कशन और PDF में बहुत डिफरेंस है. डिस्कशन में आप एक दो तीन क्वेश्चंस डिस्कस कर लेते हैं, ठीक है? तो ओके, सो लेट्स स्टार्ट. Kia is there with me, so Kia will answer all questions now. Okay, Kia? Okay, yes, great. So last paper left, I think July 2023 is left. Why I left? Because I thought कि वो इतना easy paper था कि मुझे लगा कि शायद या I don't think कि मुझे easy बहुत लगा, तो उसको मैंने रखा है बिल्कुल एंड पे हम डिस्कस करेंगे. और वो बेसिकली मैं कुछ नहीं बोलूंगी, वो सब आप लोगों ने उसमें आंसर्स देने हैं, ठीक है? वो इसलिए फिर उसको मैंने स्किप किया. सो लेट्स कंप्लीट टुडेज पेपर जनवरी 2022. January 2023, few questions were left. I wanted to discuss, but we will discuss in next class. Okay, I have uploaded previous lecture. Okay, so वहां तक बस uploaded है, rest आगे सिर्फ lectures uploaded होंगे, ठीक है? Okay, so let's start. Where is my note? Okay, so this paper is also, I think, very easy. So yeah, you also tell me, do you think this paper easy? Okay, you should tell me. Okay, so what happened? Okay, so nerve root of starting Bismillahirrahmanirrahim. So nerve root of iliohypogastric ilioinguinal nerve. You all know this is a very easy question. Still, I will tell you one thing in this paper as well. This question, there is, and yes, L1 is the answer. And if they ask you specifically of only about iliohypogastric, they usually ask that it also has T12 as well, T12 nerve roots as well. Okay, so basic we know that, okay, iliohypogastric and ilioinguinal L1, but iliohypogastric also has T12. Okay, so just for iliohypogastric this thing would be different. And if you just see this slide, we have already discussed so many times that which nerve transverses through where. Like all these nerves, they traverse the psoas major, and they emerge from lateral borders, except, now this exception is very important, obturator nerve from medial border and genitofemoral nerve from anterior aspect, because it pierces through the muscle. Okay, so only structure that exit lesser sciatic foramina. Genitofemoral, yes, good. So only structure here that exit lesser sciatic foramina. Tendon, yes, because why not nerve to obturator internus? Because the question is about only structure that exit lesser sciatic, not both lesser and greater sciatic. Okay, so this table again is very, very important, because this nerve to obturator internus is passing through both foramina, greater and lesser sciatic foramina. So ductus venosus, it connects, this is also again easy thing, it connects umbilical vein to the inferior vena cava. Okay, so allantois, revise this table once at end. Which table? Okay, no, let's revise it now. Basically, very easy way to remember this greater and lesser sciatic foramina. Okay, just you have to first remember that which things are passing from both foramina. Like I have bold this pudendal nerve, because what happens is that through greater sciatic foramina, basically those things like all the nerves, arteries, they have to go back. So through greater sciatic foramina, the things are going back to the gluteal region. So those things which have to go to the gluteus or to the thigh, they have to go through the greater sciatic foramina. And what happens with pudendal nerve? Basically, pudendal nerve, it just goes through the greater sciatic foramina, and then it turns back through the lesser sciatic foramina and it enters the perineum. Because through the lesser sciatic foramina, things enters the perineum. So only lesser sciatic foramina has those structures which are in your perineum. So you have read all the anatomy, you know, pudendal nerve, pudendal vessels, they are in the perineum. Nerve obturator internus and obturator internus tendon, they are in the perineum. Okay, so these are lesser sciatic foramina. In greater sciatic foramina, if you just see that two muscles are important. One is in lesser sciatic foramina is obturator internus tendon, and greater sciatic foramina, it is the piriformis muscle as well. Okay, and the nerves. Nerves, if you see sciatic nerve, you know that sciatic nerve has to go to the back, gluteal, both superior and inferior gluteal nerve, posterior femoral cutaneous nerve, nerve to quadratus femoris. Okay, these things, they go to the gluteus and thigh. So that is why they are leaving through the greater sciatic foramen. And again, pudendal vessels, gluteal vessels. Okay, so this is very easy. Just have a brief understanding of this table and you will remember. Okay, so ductus venosus, you know, umbilical and inferior vena cava, allantois. Allantois is a part of your GIT. So it was derived from ectoderm, mesoderm, endo, lateral plate, intermediate mesoderm. These germ layers are very, very important. Okay, endoderm, yes, great. You need to remember that as well. Okay, so I think I have not added here the table. I will add that table anywhere. Okay. Okay, so about the PCOS. Now you have to tell me about these hormones: insulin, estradiol, sex hormone, binding globulin, and leptin. Which is increasing and which is decreasing in this PCOS? So in PCOS, you know that the basic problem is your, like, insulin would be your in the high. Okay, and you know, the sex hormone binding globulin would be low. Both these factors, basically, they opposite alternate. One thing is high and other thing would be low. Okay, and leptin is basically also decreasing. Estradiol, no, estradiol, there's a little bit controversy again in this, but still it is not reduced. It is either it is increased or it is normal. It can be normal or it can be increased, it cannot be low. Okay, so this option would be correct here. If you see this table from book, androgens would be increased, both testo and androstenedione. LH would be increased, normal would be FSH. Okay, but LH, still they say that LH is only increased in 40% of individuals, and also in the thin lean women it is increased. Fasting insulin is increased, not routinely you measure fasting insulin. Sex hormone binding globulin is decreased. That is why the androgen, free androgen index is increased, because these binding globulins, they bind the androgens. When this binding globulin they decrease, then the free androgen level is increasing. That is the reason the hyperandrogenism, the symptoms, and all these things, hirsutism, they appear. Estradiol also increased, and also the estrone. So this estrone is basically the peripheral conversion of estrogen from the by the aromatase, okay, from the adipose tissue basically. And also the AMH would be raised. So all these factors, all these serum endocrinology is in the PCOS. Okay, so odds ratio, you know, you must be getting a question on odds ratio. So it is a very important thing, and you need to know how to calculate. Very easy way to calculate, but first you need to, if they have given you in the table form, then it is good. But if they have not given you the question in the table form, you have to then write it down. So again, the crisscross would be your odds ratio. What does it means? First, you take odds of exposure for cases divided by odds of exposure for controls. So these are the first column is your diseased column, like any disease, like here it is lung cancer. The second column is controls, or you can say the normal individuals. So no lung cancer here. And here would be your exposure. Okay, so exposure is in the form of either smoking, or either here exposure is negative. Okay, so smoking, non-smoking. Okay, so this is a basic way to calculate. And what is actually the result of odds ratio? If the odds ratio is equal to 1, it means that exposure and non-exposure, they have no difference. Okay, so no association of any exposure. Like, it means that both the smoker and non-smokers, they have equal predisposition to the lung cancer. So it means there is no role of exposure, so no association. If the odds ratio is more than 1, then it means that it has higher association with the disease. And if it is less than 1, it means that it has lower association with the disease. So it means it would be in the protective form. Okay, so here the question, they have given you A, B, C, D in the form of A, B, C, D. So it's a very easy way. A multiplied by D divided by this C into B. So the very easy way to remember. So this is how you can calculate. The both questions, they are very easy. So A into D and then B into C. Okay. So incidence of Turner 45X0 and its mosaicism. Do you remember, Kiha? Forgot. Okay. This incidence I have seen in this paper so much. So I think there would be another question again. No, it is actually 1 in 2500. So 1 in 3000 is most likely you can select this. Okay. Okay. So origin of ureteric bud. So from where the ureteric bud and all the urinary system is originating, either from the paramesonephric duct, mesonephric duct, or endoderm. So endoderm, you know that endoderm is just for gut. Para. Para. Basically, this paramesonephric duct is only, you need to remember that only for female genital system. Okay, so your tubes like this, and then your uterus, these are basically the fusion of paramesonephric duct, and that is why the when the paramesonephric ducts, they are absent, then you have the disease of MRCH. Okay, so paramesonephric duct is for your genital system, but the mesonephric duct is for your urinary system, because you know the ureteric bud, it appears, and then from here the ureteric bud and all the kidney and all the ureter is originating. So mesonephric duct is the origin of ureteric bud. Okay, mode of inheritance. Okay, let's zoom in this. Mode of inheritance of ABO blood group. So basically ABO blood group has no mode of inheritance, you can say, because it is not like this that something is dominant and something would be recessive. They have equal dominance. Like if one parent is co-dominant, yes, great, one parent would be A, having A blood group, other parent would having B blood group, then they can be equally expressive in the child in the form of AB. So that is the meaning that it is actually the co-dominant. So A, B are the equal, they are co-dominant. Autosomal co-dominant pattern. Autosomal, they have just written that there is no sex associated link. So that is why they have said. And this O allele is recessive, because you know that the A blood group, they have either A, O, B, O in the form of. So O is recessive. O is only expressive when you have both O. Then only you will be having blood group of O. So that is why they have written this O codominance. Okay, so question is big. Okay, so you will get this pedigree. This genetics is very important. You need to remember all these pedigrees. So what they tell you in this, first generation mother is a carrier. Whenever you see the word of carrier, you just select of these two things. Only either it will be autosomal recessive or it would be X-linked recessive. Okay, because the carrier status is only in the recessive form. So mother is carrier. Like if you say that, okay, one thing is, this is the mother, okay, father is normal, second generation with 4 children. Now father is normal means this is the normal pattern. Now they have 4 children. Okay, so in 4 children, one son normal, one son affected, one daughter carrier, one daughter normal. Matlab these, yes, great, excellent recessive, because they are, now you just have these two conditions. Now you just differentiate between autosomal recessive and X-linked recessive. Now an easy way that, okay, this is actually a difference between male child and female child, just by looking at this, that one son is normal and one son is affected. Okay. There's statement about skipping generation. Yes, that is also again because there would be a grandfather would be affected. Yes, that would be again the skipping generation would be there. I don't understand that. Why? Okay, I will tell you that. Uh, okay, so here you know that how it is X-linked recessive, because just by looking at this line, that it has four children, 1, 2, 3, and 4. Now, what happens is that if you see that one son is normal, see this son is normal, this son is diseased, okay, and this daughter is carrier, and this daughter is normal. Now, just by looking at this scenario, you can say that there is a difference between male and female. You can say that, no? So it means it is related to some X-linked disease, not autosomal. Okay. So whenever you have a case scenario about a carrier status, you can say that, okay, carrier is only present in autosomal recessive or X-linked recessive. And if they have given you like this pedigree, you just write this kind of thing in the in a pen form of whatever rough paper you get. So you see that, okay, this is a difference between male and female, so it means this is your uh, X-linked disease. Okay, I'll tell you what you were asking about the skip generations. I want to remove this. Okay, what happens in the skip generations is actually the point of skipping generation and not skipping generation. No, I don't understand your question. The point of skipping generation and not skipping generation, recessive skips generation. Okay, just the point you are confused about. Yes, recessive, because recessive, see, it is not, you cannot see, you cannot take a stem, a word of this, like skip generation, because what happens is that if you have, like, if here is the case that we see, okay, this is a father and this is a mother. So here the father is diseased, means it is having a recessive disease. Okay. X-linked also autosomal. Let's see, it is an autosomal recessive. Female is normal. Okay. So what would be the outcome? Outcome will be almost all will be the carriers. Not all. Yes, all will be the carriers. Okay. So what happens is that this diseased individual, like this you say that this is your grandfather. Grandfather has passed this disease into his or his daughters or his sons. Okay. So this disease enters into the, like a mother or father, you can say as well. Mother, if you say, then this carrier status, it then goes to the further next generation. So then we can say that, okay, this generation skips, but this skip generation only happens actually in your X-linked recessive disease, because the X-linked, you know that this grandfather, if it is a X-linked disease, now here would be X, not two alleles. Why? So what happens is that because grandfather is male, it will give all his sons to Y chromosome. So that is why it cannot transfer his disease to his son. It only can transfer this allele, this diseased allele, to his daughter. So that is the reason they say that, okay, this disease is not appearing in first generation, but it will appear in the next generation. So it is just, we call it as skip generation. Okay, nothing else. Okay, so smoking adversely affects neurological function of newborn. Which receptor does nicotine bind? So nicotine, you must be knowing, in the past knowledge, nicotine binds to the acetylcholine. Okay, function of BRCA, you know that it is a tumor suppressor gene. Okay, so coagulation factors that increase during pregnancy. Okay, in this very easy thing again, This 11 and 13, they are not changed. Okay. Rest of almost all are increased. Okay. This 7, 8, 9, 10. Basically, these are increased in this pregnancy. Still 11 and 13, they are not increasing. Okay, so ovary originate from coelomic epithelium, endoderm, mesoderm, ectoderm. There was a little bit confusion previously, but now they say that it is from the coelomic epithelium. Okay. Ovary. Coelomic epithelium or mesoderm? Why I am confusing now? Do you have any idea? Mesoderm, coelomic epithelium. Why I am thinking that it is from coelomic epithelium? Let me confirm it again, because I think I have read it coelomic epithelium, and now I am telling you. Okay, I will confirm this question. Intermediate mesoderm. Mesoderm. And okay, I will confirm it again. Okay. So I have written mesoderm, and now I am telling you coelomic epithelium. Okay. So cleft palate. Okay, so cleft palate is resulting from failure of development of which pharyngeal arch? First, second, third, fourth, which pharyngeal arch? So basically, it is from the failure of first pharyngeal arch, because this first pharyngeal arch actually develops all your these muscles, facial muscles, mastications, and all that. Derivatives of second pharyngeal arch. Now, this table is again very important. This is from your past MRCOG, and they have covered almost everything here. Okay, so this is important because they can ask you from through this the nerves and arteries. They are very important. Easy way to remember is that okay, fifth nerve is here, seventh is here, ninth is here, 10 and 10. Okay, and here would be maxillary artery, external carotid, stapedial artery, and here it would be the stapes bone. Okay, common carotid, internal carotid, then subclavian, pulmonary artery. You have to remember all these arteries. Okay, so first pharyngeal artery, the muscles of mastication. So all the maxilla, mandible, these facial muscles, your temporal bone. Now the middle ear two bones, incus and malleus. Stapes is in second pharyngeal arch. Now this kind of difference you need to differentiate. In the second, muscles of facial expression. That was mastication, that is facial expression. Now the bone is here, hyoid, stylohyoid, and rictus cartilage. Third is stylopharyngeus, the inferior parathyroid and hyoid bone, then cricothyroid. Here the thyroid cartilage, the epiglottis, and superior parathyroid. And in the sixth, you know that fifth is absent. Okay, so fifth is not there. Fifth is here, intrinsic muscles of larynx except cricothyroid. Okay, so cricothyroid already goes to the fourth pharyngeal arch, and all these laryngeal cartilages are here in the sixth pharyngeal arch. Now you just need to remember that stapedial artery, epiglottis, larynx, and facial nerve, what is included in which. Okay, so proximal internal carotid artery, it is derived from, just you need to remember these things from third pharyngeal arch. Okay. Okay, so precursors of serotonin. So serotonin is how it is developed from which amino acid. Okay, so it is actually from your tryptophan. All the serotonin, dopamine, they are developed from this tryptophan. Phosphate excreted by the kidneys. You know that most of bicarbonate reabsorbed. Basically, everything that reabsorbed in the kidneys it is from the proximal convoluted tubule. Yes, great. Almost they say that 99% of solutes is absorbed through this PCT. Five, the active form of vitamin D produced. You know the active form, how the vitamin D activates. So activated form of 125 dihydroxycholecalciferol, it is formed through the kidney. Okay. So this is a question here. I don't know that it is whether it is a right question or not, but still you need to remember these things. We have discussed now stats, that how to calculate standard error of mean, how to calculate the confidence interval. So this is an easy way to remember. So standard error of mean has two formulas: standard deviation divided by under root of n, and the confidence interval is, if it is 95% confidence interval, you know that we take first mean, then plus minus z score into standard error of mean. So this is the formula through which you can calculate everything. So you know all, or you need to solve this. You know how to calculate this. So I don't think that this kind of, although it is a difficult, but they can give you an easy question like how to calculate this confidence interval. So z score, you know that whenever you have 95% confidence interval, you will be having z score of 2, and then you just multiply by standard error of mean, and then you plus and minus mean, and then you get a confidence interval. So confidence interval is your range of variables. So if you see this here, 95% confidence interval, they have given you already 92 to 108. Okay. So here, if you want to calculate, what happens is that they have given already you the confidence interval. So confidence interval has how we will solve this question. Okay. So what happens here is that you have this formula you are going to use. Now you have confidence interval, you have mean, you know z score, but you need to find out this standard error of mean. So if you see the confidence interval, you have two values, because confidence interval is basically your range. So one value is your 92 and the other value is your 108, 92 to 108. Okay, so this is your confidence interval. Now first you add this confidence interval 92, and then you can calculate standard error of mean, and the next you can calculate by putting 108. Okay, let's solve. 92 is equal to mean is your 100 plus minus z is your always 2, and this you have to calculate, like just put it as a standard error of mean it is. So not here you write plus or minus, because this would be your minus thing, because we have taken two values into, we have split it into two, like one is 92 and one is 108. You know that when you calculate the confidence interval, first you add mean plus this value, then you get one value, and then you get second value by mean minus this value. Okay, so that is how you calculate this range. So what happens is that you, if you know a basic mathematics, see this is a minus, you have to put it here on that. Okay, so what happens is that 2 into a is moved to here, and 100 minus 92 moves to here. So 100 minus 92, 8 divided by 2 is equal to 4. Okay, so 4 is your standard error of mean. Now you can calculate it by either way. Either you take 92 or you can take 108. If you calculate both, you can get the standard error of mean would be same, 4. Let's solve it again. Color red. Okay, so again, if you see that I have written that this is confidence interval is equal to, मुझे समझ नहीं आ रहा था, अच्छा समझ आ गया, दोबारा मैं फिर से दोबारा बताती हूँ. This is your formula, confidence interval mean plus minus z into the standard error of mean. Okay, so what I have taken before, I have calculated by minus, now I will take this plus. Okay, so that is why I took the bigger value, that is your 108. Okay, so 108 is equal to 100 plus z is your 2 into, like it is a. So what you say, now this is plus, now you don't need to move this a into there, so just move this 100 there. 108 minus 100 is equal to 2a. So 8 divided by 2, see it is 4. Okay, so this is how you can calculate the standard error of mean. So just you need to remember these two formulas. Standard error of mean is very, very important, and also the confidence interval. So this formula and also this standard error of mean, ST divided by N. So this is how you can calculate. Now I have all the maths has been created. It will be removed. Okay, let's remove it later on. Okay, so coming to the next question, nerve supply to structure below the umbilicus. Okay, so this is the, basically they are asking you about the inferior hypogastric nerve, splanchnic, superior epigastric, inferior epigastric, pudendal nerve. Rest of all the, you can say that they are not correct. Basically the below umbilicus is actually your T11, 12, basically all the anterior rami of T6 to 12, they actually supply this anterior abdominal wall. Okay, so T10, T11, 12, all they supply this below umbilicus. Sympathetic innervation bladder, you know that it is pelvic splanchnic nerve, and you have to prescribe a OCPs to 4 weeks postpartum women and not breastfeeding. Then additional contraception should be used. Yes, you start. You have to give 7 days additional contraception. Okay, because they can be resumed, the ovulation has already been resumed, so you need to cover additional protection. Okay, source of vitamin key is your green vegetables. Screen test for iron deficiency anemia. Okay, so this is actually a little bit confusing because I don't think this option would be correct, but actually because serum iron cannot be your deficiency diagnostic test, neither the total iron binding capacity. Serum ferritin, you can diagnose the iron deficiency anemia. Still I would think that if you get any option like this MCHC, this can be your early predictor of this deficiency anemia as well. Okay, but I don't think this option is there because I have seen this question multiple times with these 3 options. So it can be a poor recall, or you can just see that screening test for iron deficiency, because the serum iron and total iron binding capacity, they are not being currently using for this iron deficiency. You need to first see the serum iron ferritin, because this is an early marker. Okay, prostaglandin hormonal effect is your paracrine. Prolactin level in pregnancy, how much increased? It is very, very much increased. So approximately 20 to 50 folds. Okay, structure passing through deep inguinal ring visualized easily on laparoscopy. So only structure that passes through the inguinal canal, you know that it is your round ligament. Okay, and also it can be visualized on laparoscopy. Yes, round ligament arising from lateral border of cervix attached to the pelvic fascia. It is your cardinal ligament. Okay, so dorsal nerve of clitoris is a branch of pudendal. You know that nerve passing medial to ASIS, anterior iliac spine. It is your lateral cutaneous nerve. This is, I think we have discussed it, this question before, and where they said that, okay, this nerve passes beneath the inguinal ligament and medial to ASIS. Okay, there it was again, this lateral cutaneous nerve. Yes. Okay, so structure spine majority of mid-gut branches from aorta at which level? So you need to know these 3 levels, your foregut, midgut, and hindgut. And you know that foregut supplied by celiac artery, midgut superior mesenteric, and inferior mesenteric. Okay, so which are the levels? L1, yes, L1 is this midgut. Okay, T12 is your, yes, SMA. T12 is for your celiac, and for inferior mesenteric it's your L3. So these 3 levels are very important. Again, see the hindgut, you see the L3. Yes, great. Main blood supply of transverse colon. Okay, so transverse colon, you know that approximately more than 2/3 is supplied by your SMA. Okay, superior mesenteric, and there is a branch. If you see this, this is your superior mesenteric artery, and this is your middle colic artery. Okay, so this middle colic artery basically supplies almost whole of the transverse colon. Okay, just the splenic flexure, I think it is left by the inferior mesenteric artery. Okay, now again they're asking you about the appendicular artery, appendiceal artery. They are very actually love this artery, appendicular artery. So you know that it is a branch of superior mesenteric artery, but still it is a branch of ileocholic artery. So you select this ileocholic. Okay. Structures enclosing largest fontanelle. Now you know that which one is largest. First you need to know either anterior fontanelle is largest or posterior. So the diagram shows you that this anterior fontanelle is largest. Okay. So they are asking you about sutures. Okay. I think speaking structures. No, sutures. So which sutures are present in this, around this anterior fontanelle? If you remember that this is your coronal sutures on both sides, this one is your sagittal suture, and this one is your frontal sutures. So three sutures are used in this anterior fontanelle. Okay, diameters widest in mid pelvis, not widest in mid pelvis. Basically, this easy way to remember that mid pelvis, all the diameters are equal. Okay, so all you can say the widest, like I have remembered it like this: 12, 12, 12, 12 in the mid pelvis. So all three are equal, 12. Okay, and you know that pelvic inlet is wider in AP, transverse diameter, that would be 13, and outlet is wider by the AP diameter, like this, 13. Okay, so this two things also you need to remember. Okay, axis of ROC curve. Now this is in very boring thing again, but you can, because it is written in your book, so you can give a brief reading on this. So there was a graph of this ROC, receiver operating characteristic curves, and it's a plot of sensitivity against the false positive rate, which is also your 1 minus specificity. Yes, C is correct answer. So just remember this thing. You don't need to go into detail of this. Okay. Absent mastoid process, if there is in the fetus, which structure increase risk of damage during delivery? Because the mastoid process, you know that the facial nerve crosses this, so it can be damaged here. Now the alcohol group attached to which carbon atom of prostaglandin structure? Do you remember this? Prostaglandins. It has almost 20, 21, I think, carbon atom. Okay, those carbon atoms are also very important, that which one has how many carbon atoms. Okay, these all options are wrong. I have not written correct one. Basically this C, not C, basically carbon atom number 15. The alcohol group is attached to the 15 carbon atom. These options were there in the recall, so all these are wrong. Okay, the pelvic floor muscle not inserted into perineal body. So first you need to know that which muscles are attaching to the perineal body. So basically the pubococcygeus, ileococcygeus, you know that these two are parts of your levator. They are going puborectalis as well. Bulbospongiosus and ischiocavernosus. Basically ischiocavernosus goes around this through the ischium. So it is not going in the midline. So you can remember it like this, because it is around, it's on the lateral side, it is not going into the medial side. Here is your perineal body. So the puborectalis, ileococcygeus, the pubococcygeus, they are here and they attach to this body. Okay, the active predictive value, you need to remember this formula. Okay, so condition statistical difference occurs purely by chance. Now these errors are again very important. You need to remember that which one is type 1 error, which one is type 2 error. Okay, so null hypothesis, actual, basically in the type 1 error, basically we are rejecting the null hypothesis when it is actually true. So the statistical difference type 1 is your false positive. Yes, false positive. So statistical difference occurs purely by chance. So these two types, you need to remember again. One thing is your false positive and the other is your false negative. Okay, so major estrogen produced by placenta. So these three are your estrogen, and this estriol is from your placenta. Okay, and premenopausal, you know that it is your estradiol. Okay. Is 53 correct answer? Yes, it is type 1 error. You want to discuss more about these errors? I will discuss in next lecture, okay? Because we have discussed in our stats class. So I have not added those details here. I'll be adding in next lecture, okay? Okay. Or you can remind me. I will share it in the group, okay? Structure similar hormones with the TSH. You know that these are glycoproteins would be the same. Oh, what happens to us? Okay, so glycoproteins, HCG, FSH, LH, all these are yours structurally similar. Commonest cause of your hypothyroidism worldwide. Now, this worldwide is very important. This word you need to see this. Yes, that then it would be your iodine deficiency. Otherwise, it would be your in UK. If they ask you, this would be your Hashimoto's. Okay, you know that whenever your glucose level falls, your insulin level also falls or increase, and your glucagon. No, I think I have written wrong. Fall in blood when blood glucose level fall, then what happened? Insulin will fall and glucagon would be increased. Yes, that's correct. It is wrong. Yes, in C it would be there. Okay, type of atom released during MRI. You know that it is a hydrogen ion. Okay, the treatment when the device is inserted into vagina, like whenever you give the radioactivity inside the body, then it is called your brachytherapy. Okay. Okay, brachytherapy. Electrosurgery where a pad is placed on the patient. Okay, it means a long circuit would be formed. So bipolar and monopolar, these two are just your electrosurgery. So monopolar, okay, yes, great. So ultrasound process which cause lysis of cell and damage. That is actually we have discussed in the cavitation. So this cavitation is your, you can say the side effect that ultrasound can damage the cells in suspension. Okay, so these are the options and you need to select this cavitation. Okay, so you have a patient of Crohn's disease. Bowel resection has already been done. MCVC, megaloblastic anemia. So symptoms, you have numbness. So you know that this would be your B12 deficiency. Okay, now the question is your perioral numbness and spasm. See, spasm over upper limbs. Now this spasm, you know that it can be due to hypocalcemia, but still they have given you and the ECG and on that prolonged QT interval. Now they are actually asking you about the QT interval. Obviously, this kind of ECG, see, it is a normal. The QT interval is here and here the QT interval is prolonged. So you need to remember these abnormalities: hyperkalemia, tall T waves; hypokalemia, flat T waves; hypercalcemia, short QT interval; hypocalcemia, long QT interval. This is just the opposite. See, whenever the calcium is high, the QT would be short. Calcium is low, QT is long. But the opposite with the potassium. Potassium is high, the T wave is tall. Potassium is low, the T wave is flat. Okay, so this is just the opposite thing. You need to remember this table is important. Immunoglobulin, which is pentamer. This is very important table again from your past MRCG and very, very important. IgM. So IgM is only your pentamer and it's the first antibody synthesized by neonates. IgA is only your dimer, rest of all the monomers. Okay, and IgG is only which crosses the placenta. So these few points are very important. Okay, so there's a hepatina virus, basically hepatitis virus, which contains DNA. Okay, transmitted through the blood transfusion. So basically, they are asking you about all of these hepatitis virus, which one is DNA virus. Basically, they are asking you about this. So again, it's a table from your past MRCOG. If you see this, all the hepatitis viruses are RNA viruses, except only B is double-stranded. So these exceptions are very important. You need to remember. Okay. So again, there's a question about this Hep B serology. We have already discussed, but this actually is a very confusing. I think this is a wrong statement. I have also added this again because you just need to remember three things we have discussed, I think, in previous lecture. First, we just see that whenever this surface antigen is positive, it means the infection is there, either in the form of acute or in the form of chronic. If you see this question, they have given surface antigen positive and they have also given the antibodies positive. This cannot happen. So the first thing is you see antigen. The second thing is you have to see the antibody to this antigen. This is anti-HBs. Whenever this anti-HBs is there, it means you are now immune, either due to infection or due to vaccination. Okay, immunity is by two types, due to infection or vaccination. So how you calculate, how you find that that infection was acute or chronic? By seeing this IgM anticore antibody. Whenever this IgM is positive, this indicates the recent infection, and if it is negative, it means that it is a chronic infection. Okay, and how you say that this immunity was due to infection or due to vaccination? Then you move on to this fourth thing. This is anti-core antibodies. If they are positive, it means they are ever been infected, means that infection was there in the past. If it is negative, it means that this immunity is only due to vaccination. Yes, no core antibody in vaccine. Yes, great. So don't confuse yourself by looking at all these questions. Just see these 3-4 possibilities. They usually ask you about acute, chronic infection, immunity due to infection, or immunity due to vaccination. Just 4 possibilities. Okay, so this question I think we have discussed in first lecture as well, but I have not added the reference here. So reference is now here. See, the question was that patient has fatigue, which is non-pregnant. So in non-pregnant, the ALP cannot be raised. So ALP is raised, this is an abnormality. The rest of all the LFTs are normal. They're not, basically they have not given you a very detailed, just the fatigue and ALP raised. So I found out this table of alkaline phosphatase. If you see this, okay, it is raised in these 3 conditions. Now you need to know which 3 conditions: osteomalacia, osteitis fibrosa cystica, and Paget's disease of bone. Now with these alkaline phosphatase, they will usually give you calcium because hypercalcemia would be there. So this question is a little bit confusing, but you need to remember this table now. If you have given alkaline phosphatase is raised and the serum calcium is reduced, phosphate is reduced, and parathyroid is increased, see, it means the calcium is deficiency due to, or the vitamin deficiency. So osteomalacia or rickets can be there. Osteitis fibrosa you can skip, but you need to know the Paget's disease. So in Paget's disease, rest of all the things would be normal. Only alkaline phosphatase is raised. So here the excessive breakdown in bones followed by disorganized bone formation, remodeling, weakness, pain, bones, fractures, arthritis. Okay, so this kind of thing you can get in exam. So just remember this table. Okay, so this is the RMI. We have calculated RMI so many times. So now you need to remember yourself. Okay, for chlamydia. So basically these 3 things you need to now remember, that which test you need to go for these infections. So basically the current recommendation says that for chlamydia and gonorrhea, you need to go for vulvovaginal swab, not go for endocervical. Okay, so only vulvovaginal swab would be option. But in PID, you can go for endocervical, and in TB, you can go for HPS. See this chart I have given from the guidelines, BASH guidelines. They have said that a vulvovaginal sample is a specimen of choice. See, endocervical, less sensitive than vulvovaginal. Even first catch urine, they say that in men it is sensitive, but it is less. The sensitivity varies actually in the woman. Even urethral swabs less acceptable. Okay, so vulvovaginal swab you need to remember here. Okay, so neonatal herpes, you know that neonatal herpes had 3 characteristics: skin, eye, mouth lesions, neurological, and disseminated infection. So if they ask you about, okay, which thing is positive, you can say congenital malformation is not there in neonatal herpes. Conjunctivitis, eye is there, skin is there. Pneumonitis can be if it's in the form of disseminated, not else. Okay, CMV infection we have discussed. What happens? CMV infection we have discussed previously. So in the second trimester, the risk is more than 40, means 40 to 50%. Okay, if you get this kind of picture, you know that this is a flagellated some parasite. So it is your trichomonas. AMSEL criteria, these 4 criteria you need to remember. Now the absolute contraindication with a history of embolism. Whenever there's a history of DVT or embolism, you need to avoid COCP for whole life. And this is the HRT risk with the breast cancer. It is your 3 times risk. And again, okay, so this is your 30 centimeter cyst in a young, very young age woman. We have discussed in our lectures as well that whenever the female is less than 40 years, you need to go for all these tumor markers. LDH, AFP, beta HCG, and also you go for CA125. Okay, so you go for all the tumor markers because the germ cell tumors are common in young adults. Choreo spread through the blood, so hematogenous spread. Origin of CA125 is coelomic epithelial structures. Stella phenomena is in your endometrium. Crosses the placenta, we know that IgG. Okay, so here is the patient. They have tell you that 22 years with menorrhagia. CBC you have already done. What additional you should do? Still here is you can say coagulation, but still you need to see the question that if they have given you that, okay, this have menorrhagia is from the menarche, since menarche, then only you can go for coagulation, not otherwise. Okay, just we are going for CBC. Okay, so false positive for syphilis, this VDR is giving very false positive results. Okay, so this is a little bit boring, confusing, and difficult, you can say. Now you may get these kind of questions in exam, so just easy yourself and just remember few things, not go into very detail of this. Whenever they give you question, see the question is 2 groups of patient. Few points are important, you need to remember. Okay, there are 2 groups, one with history, no history of hypertension, the other is history of preeclampsia. This is not important for you. The data is non-parametric. Non-parametric thing is your important. Now first you have to know that which tests are applied on parametric test data and which are non-parametric data. Always your parametric test are these 2, student t-test and ANOVA, and non-parametric are all these अजीबोगरीब, ठीक है? Okay, now if you see this table, okay, so the first question was, there are 2 questions, non-parametric data, 2 groups of patient. Okay, from the non-parametric you can see the chi-square is your the most common. Okay, so if you see the chi-square, any number of groups means you can take 2 groups. So confused between A and C in this question. Okay, so basically in Mann-Whitney you cannot take more than, okay, yes. So basically the chi-square is important because you can use any number of groups. So 2 or 3 you can select chi-square because t-test chi-square they are most common. So just remember these few things, don't go into very detail. And if you otherwise the next question is, if you see this 3 groups of patient, data is statistically significant, and this, here you would be your parametric test would be applied. So parametric are only, you can say, the student t-test and ANOVA. So t-test only 2 groups, but you can ANOVA you can use 2 or more groups. Okay, so here you can say that it is an ANOVA, and here you can select the chi-square. Okay, so just remember only these 3 tests. Just remember this chi-square, this t-test, this ANOVA. Okay, so rheumatoid arthritis, you know that it suppress less frequently flare up in pregnancy because you know that there are 2 types of helper cells. So T helper 1 cells they suppress. What happens is that in pregnancy T helper 2 are actually increased during pregnancy and 1 actually decrease. So T helper 1 suppression improves rheumatoid arthritis, and increased activity of T2 basically it is the result of that the SLE flares up in the pregnancy. Okay, so this is very important thing. Mode of action hydralazine, you know that it is a vasodilator, and nifedipine, it also decrease the contraction of smooth muscle. So vascular resistance, it decreases. Belongs to your equalize your enterobacteriaceae, you know. Group as well, that if they have asked you about the catheter, the infection would be by the Pseudomonas. So the strep infection, the toxin is your exotoxin, not enterotoxin. I don't know why they have written the enterotoxin. Okay, the bacteria becomes inactive, not kill. It means the bacteriostatic is antibiotic. Syphilis treatment is your penicillin. Fetus head is at the pelvic floor. Now, which operative delivery you would go for? This is your table from guidelines. They say that when the head is at the 0+1, then it is mid cavity forceps. If it is below this level, means +2, that it means the low cavity forceps. So +3, +4, this would be your perineum or full floor. Okay, so then you can go for outlet forceps. Don't need to go into very detail, just you need to remember these stations. Okay, so this is external anal sphincter less than 50% tear. This is your 3A Brenner tumor. Okay, I want to finish this. Okay. Okay, this Brenner tumor, they ask you about the malignant change. So basically, they say that I did not know this table. No, you don't need to go into detail. This is for you basically part 2 MRCOG. This is actually your guideline table. So I just mentioned that these are 3 levels of your forceps delivery, which forceps you apply at which level. Okay, so for mid cavity you need to go for rotational forceps. Okay, so don't need to go into very detail, just 0+1 whenever the head is, you go for mid cavity forceps, +2 you go for low cavity, and outlet forceps +3, or you can say the pelvic floor. So Brenner tumor malignant change less than 5%. Some books say the 2%. Okay. So answer is B. No. Answer is outlet delivery. Outlet pelvic floor. The head has already reached the pelvic floor, perineum. So it means that now you need to go for this outlet forceps, not mid cavity. Okay. Yes. So the Brenner tumor malignant change is the less one you have to select. Either it is less than 5%, 5%, 2%, whichever is written. Okay, ventouse cup, where you attach during flexion. So basically, ventouse cup you need to attach to the flexion point, and that is your approximately between your 3 centimeter from anterior fontanelle, and it should be in the middle. Means that middle suture would be your sagittal suture. So middle line you have to apply this ventouse. Yes. See, okay. So again, this is sensitivity. I don't want to solve these questions now. Now you have to solve. If you have any question, you can ask me again. Okay, vulval CA, the type would be squamous cell, fallopian tube. We have discussed serous adenocarcinoma. Okay, so here the post-hysterectomy patient, sodium is 123, very less sodium. Okay, so whenever there's a post-op patient, the immediate you can say that okay, either it is due to excessive fluid given, or it can be due to a syndrome of inappropriate ADH. So likewise the option you can select both. Okay, so the commonest type of degeneration in fibroid we have discussed, hyaline degeneration. If it is they ask you about the pregnancy, then only the red degeneration. Okay, so thrombophilia screening. Okay, so if you see this thrombophilia screening, it is occurred in the spontaneous stillbirth, occurs at 34 weeks. No, this question has not given you a detail that either this thrombophilia screening occurs in the pregnancy or after the pregnancy. First, you need to know, because during the pregnancy, you cannot screen any thrombophilias, either in the form of acquired or the inherited. Okay, first you need to see this thing. Okay, so if they have clearly tell you that, okay, this test has been done in during pregnancy, then you have to repeat later on. So out of all these things, one thing they have said that, okay, protein S is reduced. See, this is a inherited thrombophilia, but still they have given the option that, okay, it can be affected by pregnancy. So in this statement, it is not clear. So you need to see that either it is done during pregnancy or after. Okay, so all these are your inherited thrombophilia. Only your APLA, antiphospholipid syndrome, is your acquired. So common side effect of oxybutynin, the dry mouth. Warfarin embryopathy is your nasal hypoplasia. This is a question we have already discussed. Whenever the gestation sac is 2 mm, then it would be around 1000 beta hCG. Puke score 15. I think all the questions are repeating now. So in the sling operation, you take this ligament, either iliopectineal ligament, or you can say the sacrotuberous ligament. Not sacrotuberous, uterosacral, sorry. Uterosacral. Okay. So downregulated HLA, they say that, okay, A, B are downregulated in pregnancy. MOA of mechanism of action of finasteride, it is your 5-alpha reductase inhibitor. Okay, shoulder dystocia, whenever you get a shoulder dystocia, first thing you go for this McRobert maneuver. Okay, so aspirin and brufen, the difference is just that this aspirin irreversibly inhibits COX and more selective COX-1 inhibitor. Okay. So dinoprostone is your PGE2 analog and the highest level pre-menstruation. So basically, there are two prostaglandins which are important around menstruation. During menstruation, E2 levels are highest, and pre-menstruation, the F2 alpha is increased. Okay. Advantage of 2 versus 1 in during pregnancy or during labor, you can say that. Basically, this E2, E1 is actually more effective, you can say, but advantage they are asking about 2. So T2 advantage is that they decrease the risk of hyperstimulation. That is why it is a safe prostaglandin during pregnancy. Okay, so thalassemia, globin genes are defected, lung volume decreased, every kind of residual volume is decreased, extra chromosome 18. So E for 8, 8, 18, and E for Edward. Okay. Limb abnormalities are also with this Edward. Rett syndrome, this is your mode of inheritance. You need to know X-linked dominant. This dominant inheritance pattern are very important. FSH, you know that it is secreted by, not secreted by, FSH acts on certain cells. This is a different, wrong question. Acts on certain cells. Okay, enzyme for nitrogen synthesis in ovary is your aromatase enzyme. Yes. Okay, now the primary amenorrhea. Now you can get 2 questions of primary amenorrhea. We have discussed, I think, in the previous lecture as well. So primary amenorrhea, whenever you get that secondary sexual characteristics are present and uterus absent, it means it is your MRKH. And whenever they give you that scant pubic hair and either like hair in the form of that, they have given you that inguinal hernia was there in the childhood, it means it was a male. So here it would, the karyotype would be XUR, and here the karyotype would be XX in the MRKH. So this is your androgen insensitivity, and here absent uterus, it is your MRKH. Secondary sexual characteristics are present. Central precocious puberty. Precocious, if you just know that, okay, the puberty is just early appearing. So it means your hypothalamus, pituitary are early developing. So for treatment, you need to suppress that. And for suppression, you need to give the GnRH analogs, okay? So class of drugs, hyperprolactinemia, mostly the antiemetics, they are actually have side effects of like domperidone, metoclopramide, they have the side effect of hyperprolactinemia. Bile acids, cholic acids, the oxycholic acids are there. Vasopressin are produced by this hypothalamus. The nucleus are important again. Leptin, you all know that it is from your adipose tissue coming. Okay. So during cesarean section, how you can reduce the risk of surgical site infections? Now they recommend that no shaving is important, just the antibiotics are important. Manual removal, exteriorization, all these things are not important. BV, why the bacterial vaginosis occurs? Because the lactobacilli, this is normal bacteria, it actually, this concentration falls down. Okay, so whenever the early pregnancy, only the T4 is decreased, the TSH 18 would be normal. Basically, this would be 1.8. Okay, but just they have written that it is normal. So thyroid hormones, they can be, they can be decreased because that HCG is acting on this thyroid. So it can be a normal finding. You just don't need to treat this. Just need to repeat after first trimester. Okay, so here they have given you glucose levels, which is fasting is 5.8 and 2 hours is 7.9. So we have discussed in the nice guidelines of diagnosis of this OGTT. The level is 5.678. Easy way to remember. This is your diagnosis for OGTT. Whenever fasting is more than 5.6 and 2 hours postprandial more than 7.8, it would be diagnosis for GDM. Half-life LH, we know that 20 minutes. Oxytocin onset of action is 3 to 5 minutes, some books say. So 3 to 5 minutes. Amniocentesis, we have discussed last lecture, it is 0.5%. So if you get 0.5% option, you need to select that. Direct activator of aldosterone, you know that angiotensin 1 converts to 2, then it acts on this aldosterone. Commonest tumor we have discussed previously. If you get the option of neuroblastoma, select this, or you can say the sacrococcygeal teratoma. So the patient amenorrhea, she diagnosed with anorexia nervosa. So BMI, see the anorexia nervosa. So it means the problem would be your hypothalamus. So hypo क्या कहते हैं उसको? Hypogonadotrophic hypogonadism. That would be the problem because it is in the pituitary. So pellagra is actually the vitamin deficiency of your niacin. Calcitonin secreted by your thyroid gland. Lithium has Epstein anomaly. Prolactin secreting tumor is your adenoma. Okay, intermittent auscultation for first stage of labor. This you need to remember that for intermittent auscultations, you need to auscultate immediately after contraction for at least full 1 minute. For first stage, every 15 minutes, and if they ask you about second stage, then you go for every 5 minutes. Okay, this is the difference. T4 to T3, 14 to 1. Plasmodium species, heaviest burden, falciparum. Frequency of TVS, 5 to 10. Minimum amount of sperm. I'm going faster. If is it right for you? Okay, because these are just repeated questions. Yes, 15 millions. Great. Free T3 is your 1%. Protein for coiling DNA histone. Drosperinone, we discussed, it is an anti-androgenic. Cannot be used as tocolytic. So first you need to know that which are tocolytic. Uratoxaban, Fadipan, indomethacin, terbutaline, all are tocolytic, not prostacyclin. Female urethric rankle due to hypoestrogenic state. The rankle form chancroid, we have discussed Haemophilus. Okay, so parasitic infection can cause miscarriage, means lethal parasitic infection is your basically malaria. Pain score, which type of variable it would be, because it is in the form of a grading system. Like we say that, okay, pain is 0 1, it is in grading. So it is in the form of a order. So the data would be ordinal. So blood loss, again, it is in the form of order, like it is a 500 ml blood loss, 1000 ml. So it is in the form of a order. You say that it's a low blood loss, a high blood loss. So ordinal data. COCP adverse effect is your thromboembolism, not irregular bleeding, because COCP is given for irregular bleeding, not a side effect of COCP. And when this is contraindicated, this is in the form of SLE, any active infection, active liver disease, SLE, thromboembolism, active or previous. All these, COCP has so many contraindications. Rotterdam criteria, you know that biochemical evidence of hyperandrogenism, you need to know. Second pharyngeal arch, the facial nerve would be there. External sphincter would be found in your deep perineal space. Okay, so IUCD, the organism associated with that is your actinomyces. HPL levels, you plateau at the third trimester. External genitalia, they differentiate between 9 to 11 weeks. Androgens, they produced, we have discussed like this GFR. So inner side is this, and androgen secrete from this reticularis. Drug which cause kernicterus is your sulfonamides. We have discussed already. Teeth discoloration, tetracycline, I think in the last paper. Granulosa cell. Now again, this question, they have said that which substance created by granulosa cells. Now, I think that this option would be that which substance is created only by granulosa cells, because the option here in, they have written inhibin as well. But estrogen is only secreted by granulosa cells. Inhibin are basically, they are secreted by both the granulosa and theca cells. Okay, so you need to see that which type of question, how the question is there. Okay, so okay, so just one thing I have passed by. So what is that? The progesterone assay in the mid luteal phase means 21-day progesterone we are checking in the infertile patients to confirm the ovulation. If it is above 30, it means that the ovulation is there. It is just a random, the point. So erythrocytes, they're developed from pluripotent your hematopoietic stem cells, non-epithelial CA that are 10%. Beta HCG tumor marker, you know that choriocarcinomas. Now this question again we have discussed in our uh, first paper, I think. So I'm not solving it again. So again, this question is here. Okay. So the next question is blood gas analysis. They have given you pH is more means alkalosis is there. PCO2 is decreased. CO2 come means it means respiratory alkalosis is there. Now, what can be the cause? Not in DK, metabolic acidosis would be there. Hypothyroidism is not associated with any abnormality. Excessive vomiting, you have metabolic acidosis. Hyperventilation, yes, hyperventilation, you hyperventilate. So the carbon dioxide is mostly excreted outside. So carbon dioxide level decreased. So this is your cause of respiratory alkalosis. Prostaglandin deactivated in the liver. BRCA, again, autosomal dominant lateral border of this fossa is your obturator internus fascia. This structure is these are two umbilical artery and this one is your umbilical vein. So achondroplasia is your autosomal dominant, I think. And in autosomal dominant, you know that all the number females and males would be equally affected. Okay. Non-ergot indigent, suppressed lactation, quinagolide, enzyme for conversion of testosterone to dihydrotestosterone would be 5-alpha reductase. Macrophages, derived from your monocytes, not mast cells. This option is wrong. Monocyte. Histamine released from all these three mast, eosinophil, basophils. Oxytocin cannot be given orally because it is destroyed by this acidic juice. Some of bodies contains the calcium. For a topic, that metho is using glycolysis is occurring in cytoplasm. Okay, so this is a under 18, the contraceptive advice. This is your Fraser guidelines. Okay, and if they're asking about any abortion, abortion advice or anything about abortion of underage girls, then it would be your Gillick competency. Okay, so remifentanil is your analgesia during labor because it is metabolized by stress. And here the ovarian mass is there, which has spindle-shaped cells, and that is your fibroma. So that is how we have quickly finished or the whole January 2022 paper. Okay, so if you do not understand anything, you just let me know in the group, or we can discuss there, or we can discuss in our next lecture as well. Okay, so let's quickly end our today's class. Any question up till now? Any question? Okay, so let's stop our recording.